Hello, everyone, and welcome to our question lab. We're happy you're able to join us today as we discuss neurology. Leading tonight's session one more time is Dr. Paras Vakaria, and he's going to introduce himself now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am a dermatology resident here at UT Southwestern in Dallas, Texas. I originally graduated from pharmacy school in Missouri and then went back home to Michigan to do medical school. And I'm also an RX coach with USMLE-Rx, so I work one-on-one with students such as yourselves to help prepare you for the USMLE Step 1 and Step 2 CK as well, and I'm happy to help lead tonight's session.
So without any further ado, let's go ahead and get into our first question on the topic of neurology. As you can see, the answer choices are covered up. That is by design. We do that because we don't want you to be distracted by those answer choices. We don't want them to guide or dictate your thought process. And we certainly don't want you to see an answer choice that you are unfamiliar with, which may cause you to panic as you're trying to answer that question. So I've gone ahead and covered those up for you here today. After that, we'd like to read the lead-in. The lead-in is the last sentence of the question itself. And the reason we do that is because we want you to know what the test writer is asking before you read the vignette, so you can pick up on all those relevant clues and prevent yourself from having to reread that question and waste time on test day. So let's go ahead and read that lead-in now. Which of the following is the most likely diagnosis? Which of the following is the most likely diagnosis? After we read the lead-in, we'd like to ask our students how many steps they believe this question will require. An example of a one-step question could be where you're asked for the diagnosis. An example of a two-step question could be where you're asked for the treatment for a diagnosis. And an example of a three-step question could be where you're asked for the mechanism of action for a treatment for a diagnosis. We'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. Our panelists are here to answer your questions, so if you have any questions, you're welcome to ask in that question box, and they'll do their very best to try to help you. I see the responses coming in, so let's go ahead and take a look at that vignette. An 8-year-old boy is brought to the emergency department by his mother due to recurrent morning headaches with nausea and vomiting for the past 6 weeks. He was previously healthy. The vital signs are stable. Physical examination shows no abnormalities. An MRI scan shows a tumor in the posterior fossa. Biopsy shows a benign tumor. Which of the following is the most likely diagnosis? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So starting off, we have an 8-year-old boy, okay? So generally, the first thing that you're going to get with the question is the demographics, and that's always important to make note of and highlight. It's really going to clue you in into what you should start thinking about and really help narrow down your differential right off the bat. Then they usually tell you about why was the patient being seen? Why did they come to the ER? Why did they come to the clinic, the hospital? And you can see here in this situation, he was coming in because of morning headaches and nausea and vomiting. Then a lot of times they like to tell you how long has it been going on for? A few days, a few years, and that kind of gives you a sense as to the sense of whether it's acute or chronic. So also helpful to take note of that, okay? In this situation, they gave us a little bit about his medical history or lack of medical history, and then also some imaging findings and biopsy findings as well, okay? Now, when we read that lead-in with Sean, we knew this was a question asking about most likely diagnosis. So we can say that this is probably a one-step question. We just have to come up with the diagnosis based off the clues in the question. Thus, it's going to be vital that we pick up on those clues to come up to the right diagnosis. So, a one-step question here. Let's go ahead and take a look at our answer choices. What we have here are 5 answer choices, okay? And what we recommend is that when you're going through answer choices, is that you start at the bottom and that you work your way up to the top. A lot of times we'll see students who, they'll start at the top, they'll select something they like, And sometimes they'll get that question wrong because they haven't gotten through all the answer choices. So we recommend starting with answer choice E, working your way up to A, and this way it prevents you from making that mistake and prevents you from biasing yourself. So we're going to go ahead and do that now. Answer choice E, pianoloma. D, pilocytic astrocytoma. C, medulloblastoma. B, glioblastoma multiforme. And A, ependymoma. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer. We'll talk about it in just a few seconds.
Excellent. Thank you, Paris. The poll is open. Once again, we'll wait until about 2/3 of you have responded before moving on. Keep in mind that there is no penalty for guessing on test day. You should never leave a question blank, and certainly not this evening. So if you're unsure what the answer is, don't worry. Take your best guess, and we'll go over the explanations here in a few moments. I see the responses coming in. We'll give all of you a few more moments here. All right, let's take a look and see what you selected. 44% of you selected D, pilocytic astrocytoma. So definitely a clear favorite. In second place, we had medulloblastoma. Let's see what the correct answer is. And the correct answer is D, and 44% of you got it right. So great job. Let me hand it back to Paris.
Thank you, Sean. So nice job on this question. So let's take a look at what's going on here. We've got an 8-year-old boy, and he's been having headaches, nausea, and vomiting for 6 weeks, okay? And importantly, they tell us that these are recurring in the morning, okay? So one thing you want to think about is, why are they occurring in the morning? And a lot of times what they suggest is, if you have an intracranial mass, when you lay down at night, a lot of that pressure can build up in your brain, so then you wake up in the morning with a headache. Okay, so that could suggest that there's an intracranial process, intracranial tumor or mass. Okay, now as you can tell, it's important to take a note of this patient's age, and that's important that we highlighted it. This is a pediatric patient, an 8-year-old boy. Okay, the most common tumor in children is a pilocytic astrocytoma, making this the most likely diagnosis. Okay, these are benign tumors. Okay. And on the next slide, Sean has gone ahead and pulled up a table on childhood primary brain tumors. We can see for pilocytic astrocytoma, it's the most common primary brain tumor in childhood. In children, it is most often found in the posterior fossa, like in our patient. It is also benign. They told us the biopsy findings suggested a benign tumor. Okay. You can see there in that image finding in letter choice A that mass is a posterior fossa mass, and there's kind of that red arrow kind of pointing to it in that image. Okay. If we take a look, we've got a couple other answer choices here in this table. You see medulloblastoma. Okay, and with medulloblastoma, this is a malignant childhood brain cancer, and it's usually in the cerebellum. Okay, and we can see that it's the most common malignant brain tumors, and we were told that the biopsy showed a benign tumor. Okay, on the next slide are some more childhood primary brain tumors in this same table, and you can see here these were some of the other answer choices. So an ependymoma. Okay, that was also one of the answer choices. These are often found in the spinal cord. Okay, these are often malignant, and they would cause hydrocephalus, intracerebral hemorrhage, so a little bit of a different presentation. A pinealoma, which was one of the other answer choices. This is a middle crania fossa lesion, not a posterior fossa lesion. Okay, and it's unusual in children as well, less common. Okay, you can get some visual issues as well. Nothing that we were told about in our patient. So let's go back to our vignette and our answer choices. We'll take a look again. Hopefully now you can see this biopsy shows a benign tumor. We're told it's in the posterior fossa in an 8-year-old boy. So most likely a pilocytic astrocytoma. We talked about why it would not be answer choice E and C. Answer choice B we haven't talked about yet. That's glioblastoma multiforme. That's a malignant brain tumor, but that usually occurs more commonly in adults. Okay, so one, the age demographic is not well, and two, that's also a malignant tumor as well. And then ependymoma we also talked about as well. So great job with this question, and I'll hand it back to you, Sean.
Well, thank you, Paras. Yes, great job. That was a tough question. Let's go ahead and move on now to our second question of the evening on the topic of neurology. For those of you wondering, next week's topic is going to be cardiology. Once again, the answer choices, as you can see, are covered up. That is by design, and we will begin with the lead-in. Which of the following symptoms is this patient most at risk of developing? Which of the following symptoms is this patient most at risk of developing? Now that we've read the lead-in, I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require, and then we'll go ahead and read that vignette. All right, I see the responses coming in. Let's go ahead and take a look at that vignette. A 61-year-old man comes to the clinic with a prickling sensation in his toes and tripping while walking for the past 6 months. He has type 2 diabetes mellitus variably controlled with metformin. His recent hemoglobin A1C was 9%. On physical examination, he has diminished proprioception, light touch sensation, and vibratory sensation in his feet. Which of the following symptoms is this patient most at risk of developing? I'll let you start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we're talking about a 61-year-old man, so a different demographic, okay? Why does he come to the clinic? Well, he's coming in because of a prickling sensation in the toes and tripping while walking. How long has it been going on for? 6 months. Okay, so right off the bat, you're told a lot of information. You definitely want to make note of that, okay? We were given some medical history about his diabetes, about the level of control, the medication he's on, his hemoglobin A1C, okay? And then some important physical exam findings, especially when you're going through neurology. Those physical exam findings are very important to go through and make sure you're understanding what that could be pointing to. So in this question, they're then asking us about the following symptoms this patient is most at risk of developing. So I think we've got a couple steps here. I think one, we've got to figure out what does this patient have, what condition, what situation does this patient have? And then two, what could he be at risk of, okay? You could maybe then argue that there's a third step. You know, there could be a couple answer choices that are correct that, you know, he may be at risk for, and we may have to figure out which one he is most at risk for. So at the very least, we need to figure out what's going on with him, and two, what is he at risk for, okay? And then we're going to keep in mind they're asking us specifically most at risk of, okay? So now that we've got those answer choices, let's take a look, and once again, we are going to start at the bottom and we're going to work our way up to the top. Answer choice E, tremor. D, muscle twitching. C, muscle cramps. B, dystonia. And A, dizziness when standing up. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Paras. The poll is open. Once again, we'll wait until about 2/3 of you have responded before moving on. I see the responses coming in. Keep in mind that we do have a raffle and a special offer, so make sure you stick around because you must be present to win, and you might be our lucky winner tonight. All right, a few more moments here. Let's take a look and see what you selected. Looks like in first place, we have dizziness when standing up. And in second place, we have muscle cramps. So let's take a look and see what the answer is. And the answer is indeed A, dizziness when standing up. And 34% of you got it right. So well done. It was a tough question, but let's make sure you got it right for the right reasons. And if not, don't worry. Boris is going to explain it to you now so you can master this concept and nail it on test day. Boris.
Thank you, Sean. Yes, great job, guys. So let's talk about what's going on. So we've got an elderly gentleman now, 61-year-old male. And what they're getting at is they're saying he has variably controlled diabetes. We can see his A1C is not very good, so poorly controlled diabetes. He does have some issues. You know, he has diminished light touch, paresthesias, diminished vibration, and altered proprioception as well. These all suggest diabetic neuropathy, okay? They can have sensory deficits. They can have diminished ankle reflexes as well, okay? So let's go ahead. Let's take a look at the next slide. Sean has gone ahead and pulled up the table, a nice table in first aid on diabetes and some of those chronic complications, okay? You can see there that one of the chronic complications at the very bottom due to osmotic damage is neuropathy. You can get motor neuropathy, sensory neuropathy, okay? One of the other things is also autonomic neuropathy or autonomic degeneration, okay? So nerves of the autonomic system can also be affected. One of those is could potentially lead to postural hypotension, okay? Now, normally, when you stand up, you have some sympathetic activity that would cause some vasoconstriction and maintain the blood pressure when you rise from a seated position, okay? However, if you have autonomic neuropathy, you may not have that sympathetic activity. The sympathetic fibers may be damaged or not working properly as well. So you may not get that normal vasoconstriction when you arise from a seated or supine position, okay? This can lead to postural hypotension, and that's essentially dizziness or falls in that situation, okay? So always important to think of autonomic neuropathy. Other things with autonomic neuropathy would be the nerves that feed the GI tract, so gastroparesis, okay? Impotence, bladder dysfunction, okay? Other things associated with autonomic degeneration. So let's take a look at the other answer choices, why those would not be as good in this answer, in this question. So A, tremor. So this would come from disorders that damage areas in the brain that control muscles. So the basal ganglia, the cerebellum, okay? Not really what they're getting at with this question of a diabetic complication. A little bit too far for a stroke at this point. Answer choice D, muscle twitching. This is something that you can see in usually epilepsy or certain issues with hypoxia or infection, not what's going on here. C, muscle cramps. This you could see in response to exercise, dehydration, or electrolyte disorders, okay? Which is, or in the setting of certain medications like diuretics or statins. Not what we're seeing here. And then lastly, dystonia. Dystonia is a sustained muscle contraction that results in abnormal fixed postures, okay? Usually after using an antipsychotic drug or certain CNS disorders as well. Not what we would expect right off the bat with poorly controlled diabetes. So great job on this question as well. Hopefully you guys were able to learn a little bit from this question.
Well, great job, Boris. Great job, everyone. This is definitely a tough question. If you find yourself struggling when you're studying, if you're like, oh, I should have gotten that right, or I knew it, but you just missed that answer. If you want to work on your test taking skills, if you want us to come up with a personalized study plan for you, whether you're an MS1 student studying for in-school exams, studying for your comp, studying for USMLE or COMLEX, we're here to help. We've got a great team of highly trained certified tutors. All of our packages include access to RX 360 as well as BRICS. We've got a great student satisfaction rating. I think we have a great testimonial here with us today. Brenda, who was a coaching student, did extremely well, is now one of our coaches. If you want the expert guidance and advice of somebody who's been where you are and is where you want to be, reach out to us at rx-coach.com. Click on the free consultation tab to talk about the program and how it can benefit you. We'll see if it's a good fit. All right. So once again, that website is rx-coach or rx-coach.com. Let's go ahead now and move on to our third question of the evening on the topic of neurology. As you can see, the answer choices are covered up, and we will begin with the lead-in. Which of the following describes the mechanism of action of the drug this patient was most likely prescribed? Which of the following describes the mechanism of action of the drug this patient was most likely prescribed? I'll give all of you a few moments to respond in the question box and let us know how many steps this question will require. Then we'll go ahead and move on to the vignette. All right. I see the responses coming in. Let's go ahead and take a look at the vignette. A 65-year-old homeless man with poorly controlled diabetes, type 2 diabetes mellitus, presents with worsening pain in his feet. It is a burning sensation in both feet that is worse at night. The pain began a few months ago. On physical examination, the feet are dry and cool with no evidence of trauma. There is bilateral loss of sensation to vibration below the ankle. He is prescribed an anticonvulsant medication to help with his pain. Which of the following describes the mechanism of action of the drug this patient was most likely prescribed? Boris.
Thank you, Sean. So once again, we are going to go ahead and show you what we think are the important clues in this vignette and the lead-in. So now we're starting with a 65-year-old man, but this is a homeless man. So right off the bat, we're told some important social history. Again, also has poorly controlled type 2 diabetes and also has pain in his feet. Okay. They tell us a little bit more about his signs and symptoms. They tell us about the duration. Okay. And then again, some important physical exam information. So always important in neurology. Okay. They then talk about prescription of an anticonvulsant that can help with this pain. Okay. And this question, as Sean read, is asking you to describe the mechanism of action of the drug that the patient was most likely prescribed. So I think we've got a nice few steps here, and we'll talk about it. One, I think we've got to figure out what's going on with this patient. What is a condition that he has that they're trying to treat? That's one. Two, what was the drug that he was prescribed? And three, what is the mechanism of action of that drug? So I think we've got a nice three-step question here. So we're going to go ahead, let's take a look at those answer choices and let's see what we're working with here. And once again, we've got 5 answer choices, and we're going to start at the bottom and we're going to work our way up to the top. Answer choice E, inhibition of presynaptic sodium channels. D, inhibition of presynaptic calcium channels. C, inhibition of norepinephrine reuptake. B, direct activation of gamma aminobutyric acid receptors. And A, activation of mu receptors. So once again, we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Excellent, Boris. As you can see, the poll is open. We will go ahead and wait until about 2/3 of you have responded before we review the correct and incorrect answer choices. As you can see this evening, we've been going through all of the answer choices, not just the correct one, and we hope that you're doing that also when you're doing practice questions. You can learn a lot from all of the choices there and deepen your understanding of those topics. I see the responses coming in. Let's go ahead and take a look and see what you selected. It was close. 32% of you selected inhibition of presynaptic calcium channels, and 29% of you selected inhibition of presynaptic sodium channels, and 27% of you selected direct activation of gamma aminobutyric acid receptor. So let's take a look and see what the correct answer is. And the correct answer is D. And 32% of you got it right. So another challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on here. So this patient, as you guys probably picked up on, similar to our last patient, also has diabetic neuropathy, okay? He's got burning sensation in the legs. He's got sensory loss as well, okay? A common anticonvulsant used to treat the neuropathic pain of diabetic neuropathy is gabapentin, okay? Gabapentin can be used for focal seizures, for post-herpetic neuralgia, okay? Now, diabetic neuropathic pain can be treated with a few things as well, with antidepressants such as tricyclic antidepressants, okay? But gabapentin and its analog, or its cousin pregabalin, can also be used for the treatment of diabetic neuropathy pain, okay? So let's take a look at the next slide. And this is a little small table that goes over some of our anticonvulsants, and in this case, gabapentin, okay? So you can see there, it primarily inhibits high voltage activated calcium channels, okay? It was designed, as you can tell from the first four letters of the name gabapentin, GABA, that it was designed as a GABA analog, okay? Most common side effect to worry about and caution your patients about is sedation. You can see there, outside of its epileptic uses, it's also used for peripheral neuropathy, okay? That's why a lot of these patients who you'll see with diabetes are also taking gabapentin, okay? So let's go back to our question. Hopefully now you can see why answer choice D is the best answer, okay? It does inhibit the presynaptic voltage-gated calcium channels as well. So you prevent calcium influx into the neuron, okay? And as a result, you get decreased firing by preventing downstream release of glutamate. Glutamate is an excitatory neurotransmitter that leads to pain. So the goal is to essentially decrease glutamate, the excitatory effects as a neurotransmitter, okay? Looking at the other answer choices, answer choice E, and we know this is an anticonvulsant, so because they said that was what was prescribed. So answer choice E would be something like lamotrigine. Lamotrigine, it is an anticonvulsant that inhibits the presynaptic sodium channels, used for focal and generalized seizures, bipolar disorder as well, but not for diabetic neuropathy. Answer choice C, inhibition of norepinephrine reuptake. This is something that would be getting more so at tricyclic antidepressants. Okay, so this is something that you could also use for diabetic neuropathy pain. However, we're told specifically this is an anticonvulsant, okay, not an antidepressant medication. So less likely to be that. Last answer choice B, direct activation of GABA receptors. This would be something like benzodiazepines that are also anticonvulsants, okay? Used for status epilepticus, eclampsia, not used for this indication. And lastly, answer choice A, activation of mu receptors. This would be opioids, okay? Opioid receptors, which are used for pain management, but not anticonvulsants. So the best answer choice here would be answer choice D.
Excellent. Thank you, Boris. Great job, everyone. That was a tough question. Neurology can be a tough topic. If you're having trouble with it, you can reach out to us at rx-coach.com. We'll be happy to help you and master this subject as well as others. Let's go ahead now and move on to our last question of the evening. Remember that there is a raffle at the end. Make sure you stick around because you might be our lucky winner and you must be present to win. So here we go. As you can see, once again, the answer choices have been removed, and we will begin, as always, with the lead-in. Which of the following additional physical findings is most likely in this patient? Which of the following additional physical findings is most likely in this patient? I'll give all of you a few moments here to respond in the question box and let us know how many steps you believe this question will require. All right, I see the responses coming in. Let's take a look at that vignette. A 25-year-old man comes to the emergency department because he has been dizzy and nauseated and unstable while walking since undergoing a chiropractic treatment for neck pain several hours ago. Physical examination reveals absent pinprick and temperature sensation on his right face, left trunk, and limbs. Ataxia of his right extremities, left beating nystagmus, and hoarseness. Which of the following additional physical findings is most likely in this patient? Paris.
Thank you, Sean. So once again, we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. And so now this is our fourth time doing this, okay? This is kind of our fourth time showing you what we think is important to take note of in that vignette, and also what are those important statements and phrases in the lead-in, okay? So hopefully you guys are starting to pick up on those and are also getting a sense of what's important to highlight and take note of, okay? So that when it's your turn to do this, when you're doing questions, you can feel confident that you're doing it correctly, okay? So let's take a look at this question. Now we've got a younger male, a 25-year-old male, and why is he coming to the ER? Well, he's been dizzy and nauseated and unstable while walking, specifically since undergoing a chiropractic treatment for neck pain. And this is very acute, happened several hours ago, okay? Then, as they like to do with these neuro questions, they give us some neurologic findings, okay? Some important findings there. We're going to have to use that constellation of signs and symptoms to come up with what we think is going to be the diagnosis, okay? So they're asking us about additional findings most likely in this patient. So I think we've got a couple steps here. I think one, we've got to come up with the diagnosis. We've got to use those clues in that vignette to come up with the diagnosis. And that's step number one. Based on that, I think we've got to determine what are some additional physical findings you could see in that condition, okay? So that's probably a two-step question, okay? We will keep in mind that they're asking about most likely, okay? So there's always a chance that there could be a couple findings that may fit with the patient. We've got to pick the one that's most likely, okay? So that's why we've highlighted that as well. So let's go ahead and take a look at these answer choices here. Once again, we are going to start at the bottom and we're going to work our way up to the top. Answer choice E, right-sided ptosis and meiosis. D, inability to recognize the left side of his body. C, hyperreflexia of the left extremities. B, diminished vibratory sensation in the right extremities. And A, deviation of the tongue to the right. So we're going to go ahead and open up that poll. Go ahead and select the answer choice you think is the best answer, and we'll talk about it in just a few seconds.
Well, thank you, Paris. This is our last question of the evening. Let's try to finish strong. We'll give all of you a few moments here to submit your responses. All right, I see the responses coming in. A few more moments here. Once again, the topic for next week is cardiology. We hope to see you then. All right. This is a tough question, so I'll give all of you a few more seconds. Let's take a look and see what you selected. 34% of you selected deviation of the tongue to the right, and 31% of you selected right-sided ptosis and meiosis. Let's take a look and see what the correct answer is. And the correct answer is E, right-sided ptosis and meiosis. So 31% of you got it right. So definitely a challenging question. Let me go ahead and hand it off to Paris.
Thank you, Sean. Yes, definitely a tough question. So let's take a look at what's going on here. So the sudden onset, it's very sudden, right? It happened a few hours ago. And the focal nature of the symptoms suggests that this patient is developing a stroke, okay? Especially an acute stroke, okay? Now, why are they telling us about the chiropractic treatment for the neck pain? Well, it's most likely the trigger, okay? So a lot of times what can happen during chiropractic manipulation, you can have a dissection or a thrombosis of a certain artery, okay? Excuse me, specifically the vertebral artery, okay? The vertebral artery gives rise to the pica, or posterior inferior cerebellar artery, okay? The pica supplies blood to structures of the lateral medulla, okay? So let's go ahead, let's take a look at the next slide. Sean's gone ahead and pulled up a nice table on the pica stroke, okay? What's known as lateral medullary, what used to be called Wallenberg syndrome, or lateral medullary syndrome. Basically, it's suggesting that the blood supply to the lateral medulla is, and as well as the inferior cerebellar peduncle, is disrupted. And so you can get a few signs and symptoms in this area, okay? You can see some of the nuclei that are in this area of the lesion, so the vestibular nuclei, okay? And that helps account for the vomiting, the vertigo, the nystagmus, okay? You can see there that the nucleus ambiguus, which plays a role with cranial nerves 9, 10, and 11, can be affected. So that's why you would get dysphagia and hoarseness, because we know that 9, 10, specifically, and also 11 play a role in that. The lateral spinal thalamic tract is also affected, so that's why you get decreased pain and temperature sensation from the contralateral body and ipsilateral face, okay? We can also see there that the inferior cerebellar peduncle is affected with this stroke as well, and that's why you can get cerebellar issues with ataxia or dysmetria. And lastly, one other things that's affected in this type of stroke that can be affected are sympathetic fibers. So that way you can then get a Horner syndrome on that side, okay? So you can get ipsilateral ptosis and meiosis, okay? So now that we've looked at this slide and this table on pica or lateral medullary stroke, let's go back to our question. And hopefully you guys will start to see that some of those signs and symptoms are matching up really nicely with pica or lateral medullary syndrome. Absent pinprick and temperature sensation from the left side of the body, but the right face. And ataxia of the right extremity, so that's suggesting cerebellar or inferior cerebellar peduncle, and that would also be ipsilateral as well, right-sided, because it's a cerebellar issue. The nystagmus makes sense because we talked about the vestibular nuclei being affected. Hoarseness makes sense because we talked about the nucleus ambiguus being affected, so cranial nerves 9 and 10 specifically, okay? So all of those cranial nerves that you would find in the lateral medulla are all being affected. So that would help point to lateral medullary syndrome, and that would help point to also the fact that sympathetic fibers can be involved. And that way you could get a ipsilateral Horner syndrome. So ipsilateral ptosis and meiosis, and that's why answer choice E is the best answer here, okay? Looking at the other answer choices, answer choice D, hemineglect or agnosia of one side. This would be if you had a lesion in the non-dominant parietal lobe. So usually after a middle cerebral artery or MCA stroke, okay? If you had an MCA stroke, that would not explain the dizziness, nystagmus, or ataxia. So less likely the correct answer there. Hyperreflexia of the left extremities. This would be an indication of damage to upper motor neurons, okay? We're dealing with a little bit of a different issue here. We're dealing here with an acute stroke. Answer choice B, diminished vibratory sensation in the right extremities. So nerve fibers carrying vibratory and proprioceptive information, they actually course through the medial medulla in the medial lemniscus, okay? So this is something that would be suggestive of medial medullary syndrome, not lateral medullary syndrome, okay? Lastly, answer choice A, deviation of the tongue to the right. This indicates damage to the hypoglossal nucleus or cranial nerve 12. This is also in the medial medulla, okay? And this is supplied by the anterior spinal artery. So also different location within the medulla. So these stroke questions can be tough, but it's important to use those signs and symptoms to really localize where that lesion is happening. And from there, you'll be able to answer a lot of these questions as well. So hopefully this was a good practice as well. Great job on this question. Questions, and hand it back to you, Sean.
Well, thank you very much, Paras. Great job, everyone. We got some challenging questions today on the topic of neurology, and here are the question IDs. If you want to take a screenshot or write these down or take a picture of it, you can simply type these QIDs into the RX search field and review these more independently. So I'll give you a few moments here to do that.